Hi there, my name is Stephanie Carpentier. I'm here in my clinic where I just finished a clinic day, and I am here to answer some questions about ulcerative colitis. I don't know what's under here. Question 1. What exactly is ulcerative colitis? Okay, well, ulcerative colitis is inflammation of the colon. Unlike Crohn's disease, that can be inflammation from anywhere from the mouth to the bum, ulcerative colitis just affects the colon. It is becoming more and more common in Canada, and we don't quite know what causes it, but we think probably it's a mixture of environmental, genetic, bacterial, and autoimmune contributors. Common symptoms of ulcerative colitis would be things like diarrhea, abdominal pain, and specifically blood. Okay, question 2. Do I have to show all signs to know I have ulcerative colitis? No, you don't. When thinking about whether or not you could have ulcerative colitis, you want to think about, first of all, the signs would be things like diarrhea or blood per rectum, abdominal pain. Any of those can be early signs of ulcerative colitis. Sometimes as you progress in the disease, you may have more and more of them. It is important to try to catch things early if you can. Also, if you have a family history or anyone in your family with ulcerative colitis, you would want to think that you're at increased risk of getting it. Is living with ulcerative colitis really tough? This is a common question. I think initially when someone's diagnosed with ulcerative colitis, we want to think whether it's mild, moderate, or severe. Sometimes, the more severe it is can be based on how things look in the colon after we do a scope. And also, we want to think about what kind of treatments are available. Initially, the symptoms, before you're diagnosed, the symptoms of ulcerative colitis can be really tough. But with adhering to medications that's recommended and with dietary modifications and living a healthy lifestyle, number one, the difficulties can improve. And number two, with support from the community and things like the Crohn's and Colitis Foundation of Canada and your doctors, the lifestyle or quality of life can really improve. I'm not saying it's going to be easy because ulcerative colitis is a chronic condition, but working with your healthcare providers and talking to other people with the disease, one can learn to adapt to some of the symptoms as they start to improve with medications. Also, sometimes people with ulcerative colitis do have to have, sometimes medications don't work. We have good medications and quite a few of them, but sometimes people don't respond like we'd suggest. And in that case, ulcerative colitis can actually be cured. It can be cured with a surgery called a colectomy. Actually, a lot of people fear getting surgery for ulcerative colitis, but a lot of patients that I've seen who did end up or choose to have surgery to cure their ulcerative colitis do have a good quality of life. And patients can have a very good quality of life with minimal symptoms, even if they've had surgery for the disease. Okay, question 4. How do doctors figure out if you have ulcerative colitis? Great question. By physical examination, by clinical signs, laboratories, as well as a colonoscopy, the doctor determines whether or not that's the diagnosis. There's not one diagnostic test for ulcerative colitis. It's a combination of a couple tests and history and talking to the patient that arrives at the diagnosis. This is the last question. Really, that's all you've got for me? Okay, number 5. What kind of treatments are there for ulcerative colitis? Okay, all right. So there are 3 types of treatments. There's lifestyle treatments, there's medical treatments like medicines, and then there would be a surgery that we talked about. And so the lifestyle things would be, number 1, coping with the diagnosis. It can have an impact on your mental health. Seeing your primary care provider or family physician to go over kind of the impact that a diagnosis like this might have on you. Reaching out through the Crohn's and Colitis Foundation to talk to peers is really part of the therapy. Also, you want to maintain a healthy lifestyle because ulcerative colitis is a chronic condition, you can have it up until you're old, or the elderly people can be diagnosed with this. So it's really important to maintain nutrition, maintain adequate sleep, figure out how to reduce stress or cope with stress, and have a healthy eating program, ideally free of processed foods, or as free as one could be. Then there's also medical therapy, and that consists of sometimes pills to take that reduce inflammation. There's also pills that people can take to modulate the immune system, because we know it's an autoimmune condition, so we want to decrease the abnormal immune response. Then there are also so-called biologic therapies, and biologic therapies can be intravenous or injections that people can actually do themselves. Some of them are kind of like an EpiPen, and that also modulates the immune system and decreases the abnormal immune response. There's also one other therapy for ulcerative colitis called small molecules, and those are used in other conditions like rheumatoid arthritis and psoriasis. So a lot of these medications overlap with other conditions, and those are also used in moderate to severe cases of ulcerative colitis. Remember, you're not alone in this journey. If you've been diagnosed with ulcerative colitis, or if you think you may have symptoms of ulcerative colitis, reach out to a healthcare provider. Together, ulcerative colitis can be managed and your quality of life can be improved.